Mapchats.
Good afternoon, and welcome to the next edition of Mapchats, a webinar dedicated to all things data and mapping. Today we'll be talking about mapping food access, and we will hear from 3 experts in the field about how they use data and mapping in their healthy food access work. My name is Kristen Crandall. I'm a data analyst here on PolicyMap's data team, and I'm excited to be your moderator today. As you may know, roughly 30 million Americans, so around 1 in 10, are living in communities without adequate access to healthy food. Over the last 10 years or so, increased awareness of this has spurred some national and local efforts to expand healthy food access, particularly in low-income communities. So today on Mapchats, we will dive into how community development financial institutions, government agencies, and other organizations are using data and spatial analysis to understand the food landscape in an area and to start thinking about and implementing appropriate interventions. We'll start with a presentation by Lance Loethen from the Reinvestment Fund, and then we'll hear from Jim Walker from the Florida Community Loan Fund and Robin Safley from the Florida Department of Agriculture about how they use data and mapping to guide their healthy food access work throughout the state of Florida. Before we get this session underway, let me just give you a quick agenda for our talk today. Each of the 3 presenters will speak about their work for approximately 8 minutes, which should leave us hopefully around 30 minutes for questions and discussion. And since we are on a webinar, I would just encourage you to contact us if you're having any problems with technical related problems. Feel free to write us a note through the control panel so we can try to address them. And I also encourage you to type in your questions for the panelists at any time, and we'll address them at the end of the presentations. I know a lot of information will be covered today, so you can rest assured that the webinar and slides will be sent out by email and available on the Mapchats website as well. So now that we have that covered, let's get going with the session. Our first presenter today is Lance Loethen, a research associate with the Reinvestment Fund's Policy Solutions. Lance has more than 12 years of experience researching and developing geospatial methods for measuring the social and economic impacts of community investment. He co-developed TRF's limited supermarket access methodology, trained over 20 CDFIs as part of the Opportunity Finance Network's Healthy Food Financing Capacity Building Program, and helped CDFIs prioritize supermarket financing projects through TRF's Refresh initiative. Welcome, Lance.
Thank you, Kristen, and good afternoon, everyone. As Kristen mentioned, I'm Lance Loethen. I'm with the Reinvestment Fund, and I'm going to talk to you about how TRF has used spatial data and analysis to inform our supermarket financing initiatives over the years. TRF is a community development financial institution, and we finance a variety of development in low-income areas with the mission of trying to build wealth and opportunity for low-wealth people and places throughout the Mid-Atlantic region and increasingly throughout the entire nation, actually, as we expand our geographic scope. That includes community facilities such as charter schools, child care centers, affordable housing, of course, as well as energy efficiency. And then the reason I'm talking to you today, obviously, is our supermarket financing program. We also have Policy Solutions, which is the unit I work for, and PolicyMap, as you all know. As far as our work related to food access and healthy food financing, we focus on financing supermarkets. We focus on advocating for public programs and public-private sector partnerships, for that matter, to increase access to healthy foods. And we conduct a variety of research methods and proposals and papers related to this topic, and we provide technical assistance to peer CDFIs as well as other organizations, including foundations and public sector agencies, to help them organize their programs and implement their financing programs. In terms of the types of food-related research we've done, we clearly have done the LSA analysis, which I will spend a fair amount of time talking about during my presentation. We also have other food-related research that I'll briefly touch on, and there are some links in the slides that you can follow up at your own leisure. In terms of the timeline and how TRF really got into healthy food financing, it started with the Pennsylvania Fresh Food Financing Initiative, the FFI, and that launched in December 2004. We initially looked at food access in terms of the research question around 2007 as we were collaborating with the Food Trust and looking at ways to identify eligible areas for the Fresh Food Financing Initiative. During that program, we didn't have a kind of a structured analysis that we could lean on to identify specific areas that were eligible, and that's sort of the impetus behind the research side of TRF's efforts. The impact assessment that we completed for the CDFI fund in 2008 looked specifically at a case study on the Brown ShopRite portfolio of stores to look at operating and startup costs for supermarkets in urban versus more suburban areas. The first LSA was released in 2010, right around the time the Fresh Food Financing Initiative was winding down, but also right around the time the Healthy Food Financing Initiative, as well as other state initiatives such as the New Jersey Food Access Initiative, the NJFI, were being launched in 2011. We then released our second LSA analysis and the Searching for Markets report through Loethen in 2011, and that included a variety of technical assistance programs for CDFIs on how to use the LSA. TRF's current refresh initiative, launched in 2014, is continuing that type of technical assistance for CDFIs throughout the nation. And now our most recent LSA analysis, being released at the end of 2014 and now available on PolicyMap as of this month, actually. And we also have our recent summary brief for the most recent LSA. In terms of what are LSA areas, they're areas where residents must travel significantly farther to reach a supermarket than the comparatively acceptable distance that residents in well-served areas travel to stores. That's kind of a mouthful. There's a lot of methodology behind that, and I don't really have time to go into the full detail, but we would encourage you to explore some of the methods and data descriptions on PolicyMap if you so desire. In terms of why we want to identify LSA areas, as I mentioned before, we want to, back in the Fresh Food Financing Initiative back in 2007, we wanted to establish a more consistent and reliable method for measuring access nationwide. We also wanted to identify areas where we would prioritize our financing of supermarkets and the communities in which we desire to serve. And so identifying those priority areas became really just a key part of our department's research tools. And we ultimately measure an LSA score. It's the extent to which an area has limited access, and that's how we can prioritize areas in terms of the severity of their low access. We also use leakage calculations to get at the extent to which an area has leaked demand going outside of that community, and that's really a tool more on the underwriting side. Once we've identified the mission fit component to a deal, we want to look at, how viable might this store be, and this is one way we start to get at more like a market study or a business viability perspective on the question. In terms of our most recent study, we looked at disparity ratios, so we're looking at the extent to which low-income areas are disproportionately affected by food access based on the analysis. We also calculated a disparity ratio based on the minority race and ethnicity. As you can see here, you've got some metropolitan areas such as Buffalo, Cleveland, and Pittsburgh right there at the top with rather notable disparity ratios, kind of high disparity ratios in both of those categories. Meanwhile, you have those metro areas in the bottom that actually have the opposite situation. And I would encourage you to read our report if you'd like to see more information related to those figures. The supermarket industry really is it's a very low margin industry. Its competitive environment is quite fierce sometimes, and you're seeing a lot of shakeout around the nation with acquisitions, mergers, and different store formats coming around. We use the average supermarket sales as kind of a threshold to identify the extent to which our intervention, really the magnitude of our intervention. So if we're looking at an area, for example, on this slide, if it is an LSA area and then it has less than, say, $7 million in leakage, we might want to work with a smaller store to expand. But if it's more in the order of $14 to $28 million in leakage, or greater than $28 million for that matter, in other words, double the size of an average supermarket's annual sales, then we're going to look at a larger store and possibly even multiple stores to fix that problem or to solve that problem. In terms of market structure analysis, that's something we look at for the competitive environment. I mentioned a second ago that the supermarket industry is inherently a tight oligopoly, but that oligopoly has different levels of concentration throughout the nation. And this is just a quick sample from the reports that we do for our market structure showing metropolitan areas and the intensity of their market share concentration within one or two owners in that region. As you can see, this is an example from Florida that we did for Florida Community Loan Fund. And it shows that Florida's metropolitan areas are highly concentrated compared to a lot of their nationwide peers, and certainly the nationwide average in most cases. In terms of, a lot of what I've talked about with the financing programs that TRF has looked at, we've managed several in several states, not just Pennsylvania, and now throughout the nation we've helped inform the Healthy Food Financing Initiative and its design as a federal program. And thus far I've really talked more about ways to inform the activities, being the underwriting, the technical assistance, and some of the outputs that are associated with those activities. And then outcomes and impacts are kind of the ex post analysis, right? After the programs have been established, we want to go back and look at the outcomes and try to measure the impact. And so we want, funders and the foundations that support a lot of this work, they have clear expectations that we have to then demonstrate we've achieved in terms of those outcomes and impacts. And this is the kind of analysis that, with the LSA now, we did a historical assessment of LSA populations. So we have supermarket data going back to 2005. We applied our methodology for each year going back to 2005. This table is a bit of an abridged or abbreviated table. It only shows 5, 8, 11, and 13. And it shows that many places have realized substantial decreases in their LSA populations, some not so much. So this is actually split. It's the top 10 and then the bottom 10 in terms of the states throughout the country. And this is again taken from our recent summary brief that is available on our website. Now, getting to the spatial context of this analysis and this impact assessment that I'm speaking of, this is a map of Philadelphia and the LSA areas in 2005, as well as stores, I should say full service grocery stores, with the TRF finance stores identified with a star, a colored star, and then the gray triangle being another full service store not associated with the Reinvestment Fund. And then if we jump to 2009, you clearly see additional TRF stores as well as some other stores, and you kind of see the displacement effects of some stores. And then you get to 2013, and clearly there is a rather dramatic reduction in LSA areas and the associated populations in those areas. And then, of course, if we go on to an animated file, just kind of let that run. I'm not trying to put you into a hypnotic state, but it's pretty powerful when you see those changes over time. And again, we have this for every year. It's not just the years that I'm showing here, but this is just an easier, faster way to kind of cut to the chase. In terms of additional market analysis, additional spatial data and analysis that we use for our underwriting, we oftentimes incorporate a Huff trade area model, which we use to define a primary trade area, which is the area from which residents are most likely to shop at a given store. And many times we know that an actual LSA area or a USDA food desert is not conducive to developing a store within those boundaries. So sometimes we have to use the trade area model to see if it intersects with a low access area as a way to finance a store that it may not be located inside the boundaries of the low access area, but it still serves the populations within low access areas. So I will sign off with that and hope to answer any questions that you might have later on. Thank you very much.
Thanks, Lance. So I just want to remind folks to please type in your questions for the panelists at any point. You can do that using the control panel, and then we'll get to them at the end of the 3 presentations. So now I want to introduce our second presenter, who is Jim Walker, a Senior Loan Officer for Florida Community Loan Fund. Jim has 25 years of community development finance and lending experience, including structuring financing for multifamily housing, charter schools, community health clinics, and NMTC projects. He has also worked for the National Cooperative Bank, underwriting and managing a national portfolio of grocery store loans. Welcome, Jim.
Thank you very much. Make sure this is working. Okay, I'm trying to advance my slides here. I apologize. I don't seem to have control, so if somebody wants to do that. Oh, now I am. Thank you. I apologize for the delay, but good afternoon, everybody. I'm really happy to be here to talk about how we are developing our food financing program and the value that several data sets have had in allowing us to progress much more rapidly than we would have been able to otherwise. And that's very much due to the work that the TRF and Lance in particular, and our partnership with him and Robert at the Department of Agriculture as well. Both have provided amazing information for us that would allow us to progress in our thinking much more rapidly than we otherwise were able to do. So wanted to appreciate and acknowledge that. I want to talk real briefly today just a little bit about who we are, tell you one instance in which we did a new markets tax credit funding, which really was seminal in helping our program get off the ground, and finally just cover some of the highlights as we continue to work through how we go about structuring and evaluating our role in healthy food financing in Florida. First, just briefly, you can see that we actually like maps too. We have for a long time. This is where we have developed our loans over the course of our 20-year history. So just wanted to show you that we have a lot of comfort level and enjoy using our maps. These are just a couple of examples on types of projects we have done historically. A lot of housing community development work. We have a very active new markets tax credit program where we have lent, or we have invested over $150 million in tax credits over 4 rounds. This is just a brief graph on the increase in volume of our loan activity over time. Our mission statement, which is like many other CDFIs, add value, increase our financing, diversify the kinds of products we offer, and build our organizational strength. So to briefly talk about Hitchcock's Market, this is a project in Old Town, Florida, which is in the northern part of the state in Dixie County. High level of poverty, low median income, a USDA food desert. This was a small chain that works up there. They have a small footprint as well, and they came to us, or we found them, and were able to work on a new markets tax credit project with them. It was an amazing impact. It doubled the size of the store to 26,000 square feet. Their capacity was also 50% more increase in terms of their ability to service families. It was a full equipment upgrade, accounted for an increase of 40 permanent new jobs, along with the construction jobs during the period of the build. A new grocery store. It was a total $7.3 million total development cost, using $6 million of new market tax credits, and that really made very tangible to us the power that could happen in terms of satisfying unmet demand and really creating a tremendous community impact in the marketplace. So with that, our board basically told us that we needed to get going with our food access financing initiative, not only through new markets, but to figure out how best to directly lend into those markets with the goal over time of really becoming the largest food access lender in the state of Florida. So that's our mission. The process that's helped in as we've looked at, and I've listed here that this is our game plan, but more likely than anything else, it's really just a very long set of questions that we've wanted to address as we try to create an effective financing effort. Long list, trying to understand how our capital can be best utilized, learn from the other organizations so that we're not trying to build something from scratch, figuring out what kind of products we need to develop for the market. Critically important part of it is assessing what kind of subsidies that the market will need in order to solve some of the issues that we're trying to address. Understand who our likely borrowers are, how best to incentivize them to move into the areas that show unmet need, and really formulate overall our program eligibility criteria try to understand and formulate a process that responds to the need in the market demands, the needs of our funders and our partners. This is a rather cryptic slide, but it's interesting because this basically is one of the most powerful data sets that I've ever seen in terms of helping us move forward in almost any kind of project, frankly. And I think this is stems from one of the slides that Lance had mentioned briefly in his presentation earlier, which really allows us to look at sort of the existing world of organizations that currently serve the market in Florida. You'll see around on the left-hand column there are a number of names of different organizations. The next column is the number of stores that they have in their marketplace, and just one iteration of quite a number of different iterations that we've worked with TRF and the Refresh Initiative, and allowing us to identify who's in the market, where they're serving, where they're not serving, whether our potential borrowers or the organizations typically are a lot of small entities that are independent, whether there are a lot of chains. One of the other things that was mentioned previously is we have a very high concentration in our grocery stores throughout the state, and so that there tend to be just a few very, very large chains and very, very many very small organizations. So that really helped us identify on quite a number of criteria how we could move forward. So really this was a data set that just was worth mining, and we really used it in so many different ways. First, as I mentioned, to understand who our current players are. These are the people that we think are most likely to help us address the issue that we want to address in this program. Who are the potential borrowers? Certainly there are a lot of other types of ways in which we might address access to healthy foods, but the existing players in terms of the grocery stores are certainly one of the largest that are likely to be with us as we move forward. Questions that come up around policy issues about who are we supporting, to the extent that are we trying to support the large change? Does it matter if you're supporting a large group of entities or a small independent, as long as they're serving the market? What is the potential for the size of our lending program over time? And how do we share that potential impact with our funders and policymakers to set benchmarks, to gather their interest in serving different areas and in different communities, and to help us identify the needs and really drill down in understanding and establishing what our criteria for the loan program is going to be. This was very interesting. It's a map of the LSAs, similar to what Lance did in Philadelphia. This is the northern and central part of the state. One of the things that was very telling for us was the extent to which a lot of our LSAs are in more rural areas rather than the suburban or urban communities. And when we were able to use this, along with the existing database about where our existing operators are, it gave us a tremendous amount of information to access who we should be talking to, how we should try to incentivize them. And one of the things that's sort of tangential but very, very important is we already have a large number of programs that we do throughout the state, and to what extent could there be synergies between the activities on our healthy food financing and the other kinds of community development work that we're trying to do. And this, of course, has a lot of implications for the kinds of partnerships that we wanted to create or that we could leverage in terms of our existing partnerships for other organizations. Just a few more comments, and this is for me personally, a very important slide. It's close to home in that I live in this area, and it is a map of the LSAs in Miami-Dade and South Broward. This is an area that, in many, many measures, there's a lot of poverty, extreme level of family distress in terms of housing, in terms of health care. I think it's an interesting point that Miami-Dade County, in terms of people who have used the federal exchanges to purchase health care, they're probably I think there are about 400,000 people that have accessed health care through the federal exchange, and that's more than about 35 other states fully. So there's huge level of need, poverty. We do a lot of work down here on the housing side, and there's a lot of just information that our nonprofits that we're working with talk about the need for better housing and better access to food care and the health problems that people are having. What struck me about this map is the fact that the LSAs are actually reasonably small given the wide swath of poverty throughout the southern part of the state here. And that just really forces us to step back a little bit and to have a further dialogue about drilling down into what the issues are. Clearly, food access in and of itself is important, and we want people to have the ability to walk or take short distances in order to access, but it also speaks to the broader issues around poverty that are not just availability of the food, but also people's wealth and educational levels, and really to a whole broader set of policy issues that we want to address. So as I mentioned, these were much fewer than we thought. While we were expanding on, we're focusing on expanding as the optimal strategy, there need to be many other additional program elements that will go along with that. And then finally, one thing that's really very important as well is to the extent that we're working with potential funders to be able to show how, in a tangible way, our work will be limiting those and really serving the ultimate customers that we're trying, ultimate customers and families in the South Florida communities. So with that, I will I'd be happy to answer questions as we go along. That's my contact information. Feel free to reach out to me at any time. So thank you very much.
Thanks so much, Jim. Again, I just want to remind everyone that you can type in questions at any point for any of the presenters. Just do that using the control panel. And then after this last presentation, we will have some time to answer the questions and have a discussion. So now I'd like to introduce our third presenter, who is Robin Safley, the Director of Food, Nutrition, and Wellness for the Florida Department of Agriculture and Consumer Services. She was brought to the Florida Department of Ag by Commissioner Putnam to handle the transfer of the child nutrition programs from the Florida Department of Education in September 2011. Prior to working for the department, she worked as a consultant with Capital Health Plan, advocating wellness issues in Leon and surrounding counties. Now I'd like to welcome Robin.
Thank you very much. Let's see, will I get a hold of my PowerPoint? There it is. I'm excited to be with you all today. Obviously, as the presenter, I'm talking from a perspective of a state and the use of GIS data and helping us to manage our programs and to target our resources more effectively. And then so I want to kind of go with you how we began this journey as to how we realized that GIS mapping and that analysis would help us is obviously we are in charge of the National School Lunch Program, the Summer Feeding Program, as well as the TFAT program, which is food, commodity food that's distributed through the food bank system. And then we have other agencies that are not under our purview or are run by Commissioner Putnam that deal with other nutrition programs that are also meant to address hunger in the environment. And so working with them, getting some of the data sets, we were able to merge these data points that begin telling a story about how we are addressing hunger and food access in the state of Florida. About 3 years ago, we were approached with some people wanting to introduce legislation around healthy food financing. And at that time, I really didn't feel like we had enough data to really discuss what that intervention strategy might look like. Is that 5 stores? Is that a $5 million pot? So we began doing this GIS mapping, and we were very successful. It began with our summer feeding program, and we were very successful in identifying those homes whose children were on SNAP, which is a nutrition program, welfare, that were under the age of 18. Then we put that on a GIS map. We had it geocoded. And then we put on top of that our summer feeding sites. And immediately we could tell where the children were and where we needed to expand and offer more feeding sites. And so we were like, well, that really worked there. And we have improved our summer feeding by 22% over the last 3 summers. So we knew that was a great tool. So we thought, well, you know, a lot of people talk about hunger in isolation of health care, in isolation of academic success. And we felt that maybe but with the use of GIS mapping, we could overlay these data sets that would begin to tell a story of how each of those conversations interrelate. So we used our tool. We looked at food deserts in the state of Florida, and then we overlaid that with death rates related to diet by the same census tract. And then we identified low-performing schools, and then we began to identify the assets in those communities that are currently there to address those issues, whether it be a federally qualified health clinic or a school with a nutrition program or a food bank. And it begins to tell a story about where the gaps might be. And we have, Commissioner Putnam at our Hunger Relief Forum in September released Florida's Roadmap to Living Healthy. And we're going to continue to utilize that GIS mapping tool to help us understand food access. And obviously working with Lance at the Reinvestment Fund, they were able to give us some incredible data that helped us understand what was going on in the community even more targetedly. And working with Jim over at the Florida Community Loan Fund, you know, one of the big questions when you're addressing policy, especially with that, you know, House and elected officials, and you're asking for legislation, it's very important, I believe, to be very targeted in what your needs are. And manage the expectation of what that intervention can produce. And we definitely did not want to just make the assumption that all food deserts could handle a new grocery store, because from the analysis that we've seen with Lance and some of the other data, it's very important to know what's going on in the surrounding community from the competitive side, as well as what the buying pattern is in that community. So we really feel strongly about the GIS mapping tool. We have actually hired 2 dedicated GIS mappers, so they know a lot more about this than I do, but I do believe that it's an incredible tool to tell a story and really help a state to leverage its resources in a more targeted fashion while also measuring the results of that targeted intervention and its results on food insecurity, health indicators, academic success in schools. And so it's not just about food access, but it's food access as it relates to all of those other programs. So again, this slide just reintroduces that we are looking and using this GIS tool to better understand what the market is and better understand where we would target our resources to begin addressing hunger in the state of Florida. And I think I'm probably going to leave what else has been exciting is about that we have taken the map, Florida's Roadmap to Living Healthy, and we've put it online. We're in the process of upgrading the website and also enhancing the robustness of it, so that what we're finding is that many communities are utilizing this resource to analyze their own community and to target their intervention strategies in a more succinct way, so that we all can leverage our resources better. We're not sure that more money is needed, it's just where the money's placed. But that's what we have done from a statewide perspective, and totally are engaged in the GIS mapping as a tool to help understand food access and where interventions should go. And we are even now working on even deeper understanding of each community to understand what's going on in that community, so that if you did put a new grocery store or outlet there, what else would you need to do to ensure that those individuals are shopping and purchasing that and also consuming that food. And that would be all I have, and I'm available for questions.
Great, thanks so much, Robin. Thanks to all of our presenters. We are now ready for the discussion part of our session, so I would encourage anyone that has a question for any of the presenters to please type your question into the control panel, and then we will go through them. So one question I have here from Zanat is to Robin. It sounds like they're just wondering what the pink areas indicate in the map that you showed.
Well, let me look. Let's see. Can I go back? Hold on. Let's see if I know how to go back. Right there? I'm looking, and I've got my GIS map guy here. So what we did was we took, I'd have to look at that map because we took just a snapshot of it so it wouldn't be live. So I'm not quite sure what we've highlighted there. I think it's probably identifying rural or underserved counties and communities. What we did was we took food deserts by census tract, and we overlaid death rates related to diet by the same census tract. And then we hired Mari Gallagher, who is nationally recognized in food desert analysis, and she began crunching that data and identified our top 100 tracts that are urban that have critical need, and then our top 100 tracts of rural that have critical need, because we believe that the intervention strategies for rural is going to be different than urban. So does that answer your question?
Yes, Robin, thanks so much. And we actually have another question for you from Ms. Spector, which is whether you have partnered with any FQHCs around food access.
Remind me what FQ?
Federally Qualified Health Centers?
Yes, I'm sorry, yes. We have actually met with the Federally Qualified Health Center Association here in the state of Florida and began a very robust dialogue about how we can partner not only around food access but also nutrition education with that population.
Yeah, I'd like to jump in on that question as well. TRF has financed a couple of stores now that have healthcare facilities associated with the location of the supermarket. So one is the Bettino's ShopRite in Vineland, New Jersey, which actually has, it's not just a co-location in the traditional sense where they occupy, say, the same shopping center or something. The healthcare center at the Bettino's ShopRite is actually located inside the supermarket. So in the same way that a lot of supermarkets co-located with banks and have bank branches inside the supermarket, the same goes for this in the sense of a healthcare facility, which is really powerful because, as we know, food shopping is a very frequent activity, and the more you're exposed to an available healthcare facility, the more likely one is to actually use and get to benefit from those services as well.
Great, thanks for those answers. So we have a question here from Ms. Atkins, which is, what are the major challenges and barriers to getting big data sets for your projects, and how have you worked through them? I don't know if you want to answer that, Lance, or if another one of you would like to take a stab at it.
Sure, I'll take the first shot at that one. I would say, you know, when you're dealing with a database like the Trade Dimensions supermarket store database, that is a very expensive database, especially when we're doing a nationwide analysis such as the LSA analysis. So the cost of data is clearly a big issue there. And then you just get into the sheer volume of data and the data processing at the nationwide level. We have, at TRF, we have certainly increased our capacity for large database processing and whatnot, and running a lot of scripting and the like. So that's helped. We've been able to evolve along with our, the scale of our research we've evolved our systems to accommodate that scale quite well. But, in some ways, to do an analysis for, say, 5 states versus the nation, in some ways it's all the same, but sometimes it's not. The economies of scale with data are not always, it doesn't always ring true the way it might seem up front.
And from our perspective, this is Robin, being a state agency, what we've found is that historically there hasn't been a great deal of data sharing. So we are working diligently, creating memorandums of agreement, because a lot of the data that we're dealing with is private and protected. And we do already have agreements with Department of Education and Department of Children and Family, and we're in the process of entering in one with Department of Economic Opportunity, which is our Department of Commerce, so that we can share data. And a lot of times it's just breaking down the isolated, the silos, the barriers, because a lot of people don't think of data being used this way. So a little bit of what our challenge has been is getting people to understand the power that it can have for us to make policy and direct our resources.
Thanks, Robin and Lance. So we have another question here from Ms. Choto, which is asking whether any of this data or any of these tools are available for use by individuals through public libraries so that citizens can use the data to advocate for themselves on a local level.
Sure.
Go
ahead.
I'm sorry, for Florida, with our Florida's Roadmap to Living Healthy, all of the data that we are extracting or pulling together is going to be placed on the map, and we have about 47 data sets right now that are on the map where you can overlay them based on what you're looking for, and communities are utilizing it, which is how we want it to be used, so that they can begin their own analysis. We're going to enhance it so that it's better organized, because we have more data sets that are going to go on it, but we are also going to create it where you can print from it and use it more readily. But our intention is that communities will use this map to guide their own community efforts.
So for TRF's LSA analysis and really the component data that we use to create the analysis, all of that is available on Policy Map, and that goes back. We've always done that. Every iteration of our LSA analysis has been available on Policy Map, and so the most recent release can be viewed, and you can not only create a map, you can download tabular data and like I said, just look at a variety of the input data that we use to do the analysis itself.
Great, thanks so much. So data obviously just tells part of the picture, and I was just wondering if any of the presenters have any advice for people who are listening on how to kind of rectify what the data is telling you versus what you or some other stakeholders in your area might be seeing on the ground.
This is Jim. I'd love to answer that briefly. I think that's one of the most critical issues, or certainly a very critical issue that we're facing. And one of the points I was trying to make in looking at sort of the issues around South Florida is that we know that there's a need for tremendous improvement in healthy food access and in people eating more healthily, and having the ability to make those choices. When I look at just an LSA map, those are rather narrowly confined, and so it really then forces us to think more deeply about what are sort of the policy issues that need to be addressed beyond just, data is great, but having an LSA tell you that there's not a supermarket in this area, it should not be overread in terms of, okay, if we solve that problem, then we solve the problem of people's access to food, or using food, or knowing what to do with the right food. So it really is just important data to spark the conversation.
That's a great point, Jim, and I just want to follow on with that. One of the things we did for the New Jersey program, the New Jersey Food Access Initiative with TRF's underwriting, is we noticed that in many cases, when you are on the ground and you're getting feedback from the community, you find out that the full service store in our model that is granting access to a community, turns out that may not be a very desirable store. It meets the minimum requirements in terms of size to be categorized as full service, but it may not actually be providing true full service products to customers, and by that, of course, I mean food products. And so, we see the LSA as kind of that helicopter view, guiding and maybe prioritizing attention towards areas that have a problem, have an issue based on our methodology, but then it's definitely up to the financer, being like the CDFI in this case, and then the community representatives who know the true character of the store to figure out whether or not that store is actually providing access. And so it's kind of that first step in many ways. Being a nationwide analysis, we don't know what every store really offers. We don't have that kind of data. That's the kind of data you can really only get by talking to the community and doing on-the-ground survey research, which is what we've done in the past as well.
And from a state's perspective, obviously food access is a big part of the discussion, of health. But we've worked with lead researchers from Johns Hopkins who also indicate around community health that access is a piece and a very important piece, but you can't just put a new store in that environment and check the boxes if it's done. You really have to work with a whole education and sort of transforming that buying pattern and choices toward that healthier option. So, we have identified 8 communities in the state of Florida that are of critical need, 4 that are urban and 4 that are rural, where we're going to do a deeper analysis in the community around other data sets to understand how other data might influence food access and vice versa. And we'll be working, should we have some healthy food financing path, we will be working with them and our vendor to target those communities to see if any of these interventions would work. But again, I think data is important, but you really do have to know what's going on at the block level and what that community's, you can't solve it for them. You have to have them be a part of what the intervention might be.
Great, thanks for those answers. We have a lot of great questions here, so thanks to everyone, and I encourage you to keep writing your questions. We'll probably be on for another 10 minutes or so. So the next question we have from Corey is, has the food access mapping helped communities identify other long-term opportunities with employment, real estate development, or transportation?
We, at TRF, when we did our 2008 study for the U.S. Treasury, we did specifically look at the what are oftentimes referred to as anchor effects of supermarkets. We know that high traffic and frequently visited stores like supermarkets can serve as very strong anchors for other types of retail and service sector development. And so while we have used data to do that sort of analysis in the past, it is a difficult one to do on a large scale. It requires a lot of proprietary data about business development, and it needs to be historical and longitudinal in that sense. And some of the spatial processing that we've come up with it's doable, but it's been a little bit difficult to apply nationwide. But it's definitely possible to do that sort of analysis, and we did find pretty substantial effects of putting supermarkets into economically distressed areas and then seeing a lot of other businesses follow on to that supermarket.
Great, thanks, Lance. Here's another question probably directed towards you because it's about the LSA. It's from Ms. Ginsburg. How can data tools such as the LSA analysis be used to show the impact of losing existing grocery stores?
Yeah, that's a great question, and it's one that I should have addressed during the presentation, so I'm really glad you asked that. For this most recent release, we created a measure of what we call store importance, and so we are now able to calculate kind of the what-if scenario if a store was to disappear, to close in a sense. and then therefore be removed from our analysis. And what we do is we use that not only to measure the impact, to say that this portfolio of stores is preventing X number of people from living in an LSA area or from having poor food access. That's clearly a valuable use of that, but also useful is to be able to say that by providing financing to the store and perhaps rehabilitating it or expanding it to be more competitive and to have a better selection of foods, and thereby preserving that store, you can still make that argument. Because the reality is a lot of CDFIs don't have a large enough fund to finance new construction projects. Those are very expensive projects, and so it's oftentimes cheaper to preserve a store that would otherwise probably go out of business. And that by having that component in our data analysis, we can measure the what-if scenario if that store was to disappear.
Great. Great. Thank you, Lance. We have a sort of long question here, so listen up. What would you recommend for organizations or individuals looking to understand the historical context of how people have tried to address food insecurity, particularly with respect to produce, in an urban setting so as to account for the unemployed and the homeless? Do any organizations or government bodies track the geographic distribution of the hungry in these categories? And if you want me to repeat the question, just let me know.
So I think I got all of that. I know, I mean, food security is a little bit different than food access, right? We know that, you know, we look at, with our analysis, we look at access to full-service supermarkets. We also incorporate household demand for food prepared at home, which is, of course, grocery purchases. And so we don't really differentiate in the sense of individual household incomes. We look at the aggregate income and purchasing power for each block group that could be a component to the LSA area. But I have to admit that doesn't necessarily account for each household's ability to even afford food at all, which is really what food security gets into. I will say we've had conversations about how we might be able to incorporate more of a food security measure, but I think food security and food access, while related in a sense, they're quite different things to measure in terms of how we structured our analysis.
And this is Robin from Florida's perspective. I mean, I think that's one of the things that we're attempting to do, in that we've taken the food insecurity data that was created by Feeding America, and we've broken it down to the census tract level, and then overlaid that with food deserts and overlaid that with health indicators, so that you begin to get, and then also overlaying where there are access points, as well as far as, you know, our school lunch program, our summer feeding program, or our food banks, et cetera, so that you can start really understanding how all of those elements play off of each other. We don't have the answer yet, but that's what we're trying to figure out, how it's all correlated. And you know, and the more granular, the more block level you can get, the more you can understand what some of the other indicators are that might be out there that promote or ensure food insecurity, right? What else is going on in that community? And it's probably not just hunger.
Right. Thank you, Lance and Robin, for answering that. And I think we just have time for one or possibly two more questions. So there's a question about outcomes and how they're different in different areas. Obviously, conditions vary a lot in various locations, and I am guessing this could be directed towards you, Lance, since you work with CDFIs around the country around this issue, or possibly to you, Robin or Jim, if you wanted to speak to how obstacles and outcomes have been different in different parts of Florida.
Sure, I can speak to that. I mean, in 2011 and 2012 with the Loethen Technical Assistance Program, we worked with a lot of CDFIs who, throughout the nation, who had received their HFFI allocation, and they were new to supermarket financing. They might have had a few business loans here and there that touched on food retail, but they didn't have a dedicated program for supermarket financing. And what we found pretty quickly, and I already touched on this a little bit, is that given the limited fund size in terms of launching their program, they didn't always have a lot of resources to do new construction. And I think in the end, given their involvement, some of these CDFIs have a very specific target area they're working in, and given their relationships in the community, they preferred to focus on existing businesses anyway. They wanted to cultivate existing business owners and expand their operations and improve their operations so they could maintain that business and be more competitive and serve a larger population in their community, as opposed to, the reality is if you build a new store in the presence of existing, perhaps smaller stores, that you could end up putting someone out of business. So you have to be very careful about how you allocate those resources. And that's another thing that I think a lot of the data sources available that can help you identify where you might be treading on someone else's existing retail footprint. So you can look at that spatial context of how retail expenditures are distributed in a geographic context.
Well, this is Jim. I just wanted to mention that's really the challenge in all of our work, and in many ways, the things sometimes that you can measure easiest are the things that are not necessarily truly helpful in terms of understanding major impact. And a lot of that is because it's really has been historically very hard to gather some really granular and powerful data. And I think what's very exciting for me as we look at rolling out the program going forward is the fact that DOA has put together an amazing set of data that clearly in the short term might not help us. Well, let me back up. I think it's a great set of data that over time will really put the truth or the lie to whether we're having the right impact or not. Ultimately, for example, if we're going into a community with an intervention, how does that translate over time into early deaths or healthcare interventions for preventable diseases, that kind of stuff. So these are hard questions to answer on a truly deep, meaningful way. We can use proxies which are getting to those kinds of outcomes, but really it is the ultimate outcomes of how our families' quality of life improve. And it's just amazing to see the kind of data that DOA has been able to put on their website that will allow us to track that kind of stuff over time. So very enthusiastic about being able to point to impacts that we've had as we look back on the types of programs and projects that we financed.
Great, thanks, Jim. So it looks like we have come to the end of our hour. It's gone by very quickly because it's been very interesting. I want to take a moment to thank our three presenters and thank all of you for attending as well. And just so you know, the webinar will be available online at www.policymap.com/mapchats. And we'll also be sending it and the presentation slides as well out by email to all of the attendees. And we'll also be sending you a survey, so please do take a minute to fill that out and let us know what you thought, and also give us any suggestions for other Mapchats topics you'd like to see. The next Mapchat will be coming up in June, and it will be on the topic of mapping race, equity, and inclusion. And we will be sending out a sign-up link for that soon. And lastly, I want to take a moment to let everyone know that in addition to the new LSA data that's now available free on PolicyMap, there's also a wealth of other data and mapping features available for PolicyMap subscribers that can help you with your food access work. So if you haven't yet done so, I encourage you to sign up for a free 7-day trial of PolicyMap to explore how it can help you and your organization use data to make smart decisions. We also offer month-long trials for colleges and universities. And on the slide here, you see that we did put together a few resources. I realize these are links, and so to access them, you will have to, you can do that through the presentation slides that we send out to you via email. So thank you again so much for joining us today, and if you have any questions at all, feel free to get in touch, and have a wonderful afternoon.